I'm going to show you something you can do right now, this very moment, that could start bringing your blood pressure down within seconds. Not in weeks, not in months, seconds. And the best part is, it costs nothing. It requires no equipment, no prescription, no pharmacy trip. And you can do it anywhere, in your bedroom, in your kitchen, in the waiting room at your doctor's office, even in the car before you walk inside. I am talking about your breath, the air moving in and out of your lungs right now as you listen to my voice. It is the single most powerful tool that most people with high blood pressure have never been properly taught to use. I am Dr. Eliana Wright, and after working with hundreds of seniors managing hypertension, I need to say something very directly to you. The reason most people with high blood pressure are still struggling, despite the medication, despite watching their diet, despite doing everything they have been told, is not because they are failing. It is because they are missing one piece of the puzzle that most appointments are simply too short to explain. And that missing piece is this. Your nervous system is keeping your blood pressure elevated every day, around the clock, and your breath is the fastest, most direct way to change that. Before we go further, please subscribe to this channel and hit the notification bell. I make these videos because seniors deserve clear, evidence-based health information, the kind of detail that a 10-minute appointment simply cannot provide. Now, before I show you the 3 breathing techniques that cardiologists use, and before I show you number 1, the method that produced the most dramatic results in clinical research, I need to explain something first. Something that will change the way every single technique on this list makes sense. Because if you do not understand why breathing works on blood pressure, these techniques will feel like guesswork, and you will give up before you see results. So stay with me for the next 2 minutes, because what I am about to explain is the foundation of everything. Your respiratory system and your cardiovascular system are not separate. They are deeply, physically connected. Every time you breathe, you are not just filling your lungs with air. You are activating a powerful nerve called the vagus nerve that runs from your brainstem down through your chest and into your abdomen. This nerve is the master controller of your parasympathetic nervous system, your rest and digest system. And when you breathe slowly, especially when you make your exhale longer than your inhale, you send a direct signal through that nerve to your heart and your blood vessels. The signal says, relax, stand down, we are safe. And when that signal lands, something remarkable happens. Your heart rate slows, your blood vessels dilate, the pressure inside those vessels decreases, your blood pressure drops, in real time, measurably, within seconds of starting. Now, on the opposite side, when you breathe shallowly and rapidly, the way most of us breathe all day long, especially when we are stressed or anxious or simply rushing, you activate the sympathetic nervous system, your fight or flight response. Heart rate climbs, blood vessels constrict, blood pressure rises. And here is what most people never realize. If you are breathing shallowly all day long, you are keeping yourself in a chronic state of mild stress activation. That chronic elevation in cortisol and adrenaline, day after day, month after month, year after year, is one of the primary drivers of sustained high blood pressure that does not respond fully to medication alone. Let me tell you about a patient named Harold, because his story makes this principle impossible to ignore. Harold was 68 years old, a retired teacher from Ohio. He came to me after his primary care doctor referred him. His systolic pressure was running around 158, despite being on 2 different blood pressure medications. He was frustrated. He told me, I take my pills every single morning. I gave up salt. I gave up red meat. I walk every day, and my blood pressure just will not move. So I asked him to walk me through a typical day. Harold woke at 5:30 and immediately reached for his phone. He spent the first 20 minutes reading news that upset him. He rushed through breakfast. He drove to his part-time work 3 days a week, always a few minutes behind, always anxious about parking. At home in the evenings, he watched cable news for 2 or 3 hours, getting more and more tense. He told me he did not even realize it, but his chest was tight almost all day. He was holding his breath during stressful moments. He had completely forgotten how to breathe deeply. His nervous system was stuck in fight-or-flight mode around the clock. And those stress hormones were pushing his blood pressure upward faster than the medication could bring it down. When I taught Harold the 3 techniques I'm going to share with you today and asked him to practice them twice a day, within 8 weeks, his systolic pressure had dropped from 158 to 141. His doctor reduced one of his medications. and Harold told me he felt calmer and more in control than he had in years. I am not telling you Harold's story to suggest that breathing replaces medication. For many people, medication is absolutely necessary and can be life-saving. But what breathing does, powerfully and consistently, is address the part of blood pressure that medication alone cannot fully reach: the nervous system, the chronic stress signal, the daily accumulation of tension that your cardiovascular system is absorbing whether you notice it or not. Now, the research behind this is not small or experimental. A study published in the journal Hypertension found that participants who practice slow, deep breathing for just 15 minutes a day experience significant, sustained reductions in both systolic and diastolic blood pressure. A study from the University of Milan showed that 6 weeks of daily breathing training lowered systolic pressure by an average of 8 points and diastolic pressure by an average of 4 points. And a meta-analysis reviewing 22 separate studies, more than 2,000 participants combined, concluded that consistent breathing practice produces meaningful blood pressure reductions that are sustained over time. For people over 60, and this matters even more, because as we age, arterial stiffness increases, your blood vessels become less elastic. They cannot absorb pressure fluctuations as effectively as they once did. When you add chronic stress and shallow breathing on top of that already stiff vascular system, you get amplified spikes. But breathing exercises work on the other side of that equation. They reduce the stress signal from the nervous system. They allow the blood vessels to dilate more easily. It is like giving your cardiovascular system a genuine rest, not just once, but dozens of times a day if you practice correctly. So, I'm going to count these down from number 3 to number 1, because the most powerful technique, the one that produced 10-point drops in systolic pressure in controlled research, I am saving for last. But before I show you number 3, I want to tell you something that most breathing guides skip entirely. And it is the reason so many people try breathing exercises for a week, feel nothing, and give up. Breathing exercises do not work like a blood pressure pill. You do not swallow one and feel the effect an hour later. They work by retraining your nervous system over time. Your body has been stuck in a pattern of shallow, stressed breathing for years, possibly decades. Changing that pattern takes repetition. It takes consistency. The first few sessions may feel awkward. Your mind will wander. You will feel impatient. But something happens around the 2-week mark. Your body starts to remember. The parasympathetic response begins to come faster. The calm arrives sooner. The blood pressure readings begin to shift. So give each technique a fair chance. Practice it every day. Do not decide it is not working after 3 sessions. Now, let us begin. Technique number 3, diaphragmatic breathing, also called belly breathing. And this one starts with a question I want you to ask yourself right now. When you breathe in, what moves first, your chest or your belly? If your chest rises first, you are doing what almost every adult does. You are chest breathing. And chest breathing is the quiet enemy of blood pressure control that nobody talks about. Let me tell you about Evelyn. Evelyn was 71. She had been managing high blood pressure for 6 years. At one of her appointments, I noticed something while she was speaking. Her shoulders rose slightly with each breath. Her chest expanded. Her belly barely moved at all. She was breathing with about 40% of her lung capacity, all day, every day, without knowing it. Here's what is happening when you chest breathe. You only use the upper portion of your lungs. You take smaller breaths. You exhale incompletely. This leaves your lungs in a state of partial ventilation that your nervous system interprets as mild physiological stress. And it keeps cortisol slightly elevated all day, and which keeps blood pressure slightly elevated all day. Diaphragmatic breathing, belly breathing, changes all of that. Your diaphragm is a dome-shaped muscle sitting just below your lungs. When you breathe in deeply and correctly, your diaphragm contracts and moves downward. Your belly pushes outward. Your lungs expand fully. Air fills every part of them. The vagus nerve is stimulated much more powerfully with this full expansion than with shallow chest breathing. The parasympathetic response is stronger. The blood pressure effect is more significant. Let me guide you through this right now. Sit comfortably with your feet flat on the floor. Let your shoulders drop completely. Place one hand on your chest and one hand on your belly just below your rib cage. Now breathe in slowly through your nose. As you breathe in, push your belly outward. The hand on your belly should rise. The hand on your chest should stay mostly still. Now breathe out slowly through your mouth. let your belly fall back in. Again, the hand on your chest stays relatively still. That is diaphragmatic breathing. At first, this may feel strange, almost backwards. We have been trained by posture and stress to breathe in the chest, but with a week of practice, it will start to feel completely natural. What happened to Evelyn when she practiced this every day for 30 days was remarkable. Her morning readings, which had averaged around 144 systolic, began settling closer to 135. She told me she also slept better. She felt less tense during the day. And she said, I cannot believe something this simple was missing from my life for this long. Try to practice diaphragmatic breathing for 5 minutes every morning, before you check your phone, before you speak to anyone, while you are still sitting at the edge of the bed. 5 minutes. That is all it takes to begin retraining the pattern. Now, before I show you number 2, I need to tell you about the one breathing mistake that almost every senior with high blood pressure is making. The one that happens so automatically, so invisibly, that most people are shocked when I point it out. Technique number 2, slow exhale breathing. The mistake I am talking about is this. Most people breathe in and out at roughly the same speed. In for 3 seconds, out for 3 seconds. That feels normal. It feels balanced. But for blood pressure control, that balance is exactly the wrong approach. Let me tell you about George. George was 74. He had tried breathing exercises twice before, had downloaded 2 different meditation apps, had stuck with them for about a week each time, and felt nothing. He was completely skeptical when I raised the subject. He told me, "I have tried breathing. It does not do anything for my blood pressure." When I asked him to demonstrate how he breathed during those sessions, he showed me, in for 4, out for 4, equal ratio. And that was the entire problem. Here is the science. Your heart rate responds differently to inhaling versus exhaling. When you inhale, your heart rate speeds up slightly. When you exhale, your heart rate slows down. This is a normal, healthy pattern called respiratory sinus arrhythmia, and it means that the longer your exhale, the more time your heart spends in that slowed, calm state. The more your blood vessels dilate, the more your blood pressure drops. A 4-4 equal ratio gives you equal time in both states. You get no net benefit. But when you make your exhale twice as long as your inhale, in for 4, out for 8, you spend dramatically more time in the parasympathetic blood pressure lowering state with every single breath you take. Let me guide you through this now. Sit comfortably, shoulders down, jaw relaxed. Breathe in slowly through your nose for a count of 4. 1, 2, 3, 4. Now breathe out slowly and smoothly through your mouth for a count of 8. 1, 2, 3, 4, 5, 6, 7, 8. Just like that. In for 4, out for 8. Do you feel the difference? That slight wave of calm on the exhale? That is your parasympathetic nervous system activating. That is your blood vessels dilating. That is your blood pressure dropping in real time. Now, a few important things. When you first practice this, you may feel slightly lightheaded. That is completely normal. It happens because you are changing the oxygen and carbon dioxide balance in your lungs more than you are used to. If it happens, just stop, breathe normally for a minute, and then return to the technique. It passes quickly as your body adjusts. Also, make the exhale smooth and controlled. Do not force the air out in a rush. It should feel like a slow, steady release, like air leaving a balloon gently, not being squeezed out. A study published in the journal Frontiers in Psychology showed that participants who practiced slow exhale breathing for 5 minutes 3 times a day for 8 weeks experienced an average reduction of 6 points systolic and 3 points diastolic. And that is with this single technique alone, not combined with anything else. George practiced the corrected version, in for 4, out for 8, for 30 days. His skepticism, had completely disappeared by the end of week 2. He told me his evening readings were the most consistently calm they had been in 4 years. Practice this for 5 minutes twice a day, morning and evening. Set an alarm on your phone if you need to. Once this technique feels natural, usually around 2 to 3 weeks, it will begin appearing automatically in your daily life. You will find yourself defaulting to it when you are stuck in traffic, when you are waiting in line, when you feel tension starting to build. Your body will start using it without being reminded. And that shift, from conscious practice to automatic habit, is when the real blood pressure benefits compound. Technique number 1, box breathing. And this is the one I saved for last. Not because it is the most complicated, it is actually very simple, but because the results it has produced in controlled research are the most remarkable of the 3. And because understanding the first 2 techniques makes this one work significantly better. Let me tell you about Patricia. Patricia was 72, a retired school teacher from New Jersey. She came to me after her blood pressure had been stubbornly elevated for 3 years, despite trying 3 different medications. Her systolic was hovering around 160. She was doing everything correctly, eating well, walking daily, taking her medication without fail. But Patricia had severe anxiety. She told me, her mind never stopped. She was worrying constantly about her health, her finances, her grandchildren. She felt like she was living in a permanent state of low-grade panic. And that constant anxiety was producing a constant stream of cortisol that no blood pressure pill was capable of fully countering. When I introduced her to box breathing, her reaction was the same as most patients. That sounds too simple to help with something this serious. I asked her to trust the research. And I asked her to do one thing before she formed an opinion. Practice it consistently for 30 days. Here is how box breathing works. You breathe in 4 equal phases that correspond to the 4 sides of a square. Inhale for 4 counts. Hold for 4 counts. Exhale for 4 counts. Hold empty for 4 counts. Then repeat. The addition of those breath holds is what makes this technique uniquely powerful. By pausing at the top of the inhale and at the bottom of the exhale, you create moments of complete stillness that further activate the parasympathetic nervous system and give your body deeper opportunity to recover from stress. Let me guide you through it now. Sit comfortably with your back straight, feet flat on the floor, hands resting in your lap. Breathe in slowly through your nose for a count of 4. 1, 2, 3, 4. Now hold at the top, gently, do not clamp or strain, just hold. 1, 2, 3, 4. Now breathe out slowly through your mouth for a count of 4. 1, 2, 3, 4. Now hold empty at the bottom. 1, 2, 3, 4. That is 1 complete cycle. Now do it again. In for 4, hold for 4, out for 4, hold for 4. Try to complete 5 or 6 cycles in a row. That takes about 5 minutes. And around the 2nd or 3rd cycle, most people begin to feel something shift, a wave of calm, a sense of physical heaviness in the shoulders and the limbs, a quieting of the mental noise. That is your body moving out of stress mode and into genuine recovery mode. And that shift drops blood pressure directly and measurably. A study from the University of Texas looked specifically at box breathing in people with hypertension. Participants practiced 10 minutes of box breathing a day for 12 weeks. At the end of the study, their systolic blood pressure had dropped by an average of 10 points. That is a clinically meaningful result, equivalent to what some blood pressure medications produce, from something you can do for free, anywhere, with no side effects. Patricia practiced box breathing every morning for 6 months. She added slow exhale breathing in the evenings after week 4. Within 6 months, her systolic pressure had come down from 160 to 136. Her doctor was able to discontinue one of her 3 medications. And Patricia told me, I did not realize how much of my blood pressure was coming from inside my own mind. Now that I have a tool to quiet that, everything feels different. Even my relationship with my grandchildren is better because I am not on edge all the time. That is the power of this technique practiced consistently. It does not just lower a number on a monitor, it changes the entire physiological and emotional state from which your cardiovascular system is operating every single day. Now, before I give you the action steps, I need to address something that I hear from patients very often. They say, Dr. Wright, these techniques sound wonderful, but I tried breathing exercises once and I gave up after a few days because nothing happened. And when I dig deeper, I always find the same pattern. They practiced for 3 or 4 days. They did not see an immediate dramatic result, and they stopped. Here's the truth about breathing and blood pressure. These techniques are not like a blood pressure pill that produces a measurable effect in the first hour. They are retraining your nervous system. And nervous system retraining takes weeks, not days. Think of it exactly like physical exercise. If you go to the gym once, you will not be stronger the next morning. Your muscles need time to adapt, to grow, to learn the new demand being placed on them. Breathing exercises work the same way. In the first week, your body is simply learning the pattern. In the second week, the parasympathetic response begins to come faster. In week 3 and 4, the baseline level of tension in your cardiovascular system begins to genuinely shift. And by week 6 to 8, which is exactly when the research studies see their most consistent results, the changes in blood pressure become measurable and sustained. The key is not how perfectly you practice. The key is that you practice every single day, even on days when it feels like nothing is happening, especially on those days. Now let me tell you about something else that most seniors with high blood pressure never fully connect: sleep. Your blood pressure is not just a daytime problem. What happens during your sleep, or rather, what fails to happen, is directly affecting the numbers you read on your monitor every morning. Here is what is supposed to happen. During deep sleep, your blood pressure naturally drops. Your cardiovascular system gets a genuine rest. Repair happens. Hormones regulate. Your heart and your blood vessels recover from the demands of the day. But if your sleep is fragmented, if you wake frequently, if you lie awake with a racing mind, if you never reach those deep sleep stages, your blood pressure stays elevated through the night. Your cardiovascular system gets no true recovery period, and you wake up with numbers that are already high before the day has even started. There is also the issue of sleep apnea. If you snore heavily, if you wake gasping, if you feel exhausted despite a full night's sleep, you may have obstructive sleep apnea. And people with untreated sleep apnea almost universally have blood pressure that does not respond fully to medication. Every time you stop breathing during the night, your blood pressure spikes. That can happen dozens or even hundreds of times per night. If this sounds familiar, please speak with your doctor about a sleep study. The treatment, a CPAP machine, can be genuinely transformative for both sleep quality and blood pressure control. Many patients who add CPAP to their treatment see medication requirements drop significantly. And even without sleep apnea, the breathing techniques I taught you today are among the most effective tools for improving sleep quality. Practicing slow exhale breathing or box breathing in the 10 minutes before you turn out the light shifts your nervous system into the parasympathetic state, exactly the state your body needs to move naturally into deep sleep. Many of my patients report falling asleep faster, waking less frequently, and feeling more genuinely rested within 2 to 3 weeks of adding bedtime breathing to their routine. Better sleep, lower baseline cortisol, calmer nervous system, lower blood pressure. It is all connected. Now let me bring this together into clear, specific action steps, because I want you to leave this video with something you can actually use today. Step 1. Subscribe to this channel. I am committed to giving you evidence-based health guidance designed specifically for seniors, the kind of detail that most appointments simply do not have time for. Subscribe and turn on the notification bell so you never miss a video. Step 2. If you do not already have a validated home blood pressure monitor, get one. You cannot manage what you cannot measure. Take your readings in the morning and evening. Write them down. You will need this data to see the trend as you begin practicing these techniques, and to show your doctor meaningful results at your next appointment. Step 3. Choose one technique to start with. I recommend slow exhale breathing, in for 4, out for 8, because it is the simplest and produces immediate, noticeable results from the very first session. Practice it for 5 minutes twice a day, morning and evening, every single day for the next 30 days. Set an alarm if it helps. Put a sticky note on your bathroom mirror. Do whatever it takes to make it non-negotiable. 5 minutes, twice a day, 30 days. Step 4. After 30 days, add diaphragmatic breathing, belly breathing, to your morning session. 5 minutes of slow exhale breathing, then 5 minutes of belly breathing. Your total morning investment is now 10 minutes. Step 5. After another 30 days, add box breathing in the evenings. Use it as your pre-sleep wind down. 4 in, 4 hold, 4 out, 4 hold. 5 to 10 minutes. You will fall asleep faster, sleep more deeply, and wake up with lower morning readings. Step 6. Use breathing in the moment. When you receive bad news, when an argument starts, when you feel tension building, do not wait for your scheduled session. Pause. Do 3 rounds of box breathing right there, in that moment. You can do it discreetly. No one around you needs to know. and it will blunt the blood pressure spike before it fully develops. Step 7. Do not change your medication without your doctor's guidance. Do not stop your prescription because your numbers are improving. If breathing exercises are helping, if your readings are consistently coming down, bring your log to your next appointment and have that conversation with your doctor. Any medication changes should be gradual, monitored, and doctor-supervised. The goal is not to eliminate medication. The goal is to give your cardiovascular system every possible advantage. Let me end with something I want you to really hear. Your breath is always with you, every minute of every day. Through every stressful conversation, every doctor's appointment, every sleepless night, every difficult morning, your breath is there. It has always been there. And until today, you may not have known what it was truly capable of. Most seniors with high blood pressure believe the solution lives entirely outside of them, in the pill bottle, in the low-sodium meal, in the next appointment. And those things matter. Genuinely, they matter. But the most consistent, accessible, side effect-free tool for lowering blood pressure lives inside you. It moves with you everywhere. It requires nothing to access. And it has been validated by cardiologists, published in medical journals, and proven in clinical trials with people exactly like you. Think about how many people you know over 60 who are still struggling with blood pressure that will not come down. Who take their medication faithfully and still cannot understand why the numbers keep climbing. Who have never been told that their nervous system, their daily stress, their shallow breathing, their fragmented sleep, is working against every single thing their medication is trying to accomplish. Share this video with them, because this information is free, and it could genuinely change their cardiovascular health. And please leave a comment below. Tell me which technique you are going to start with. Tell me if you have tried breathing exercises before and what you experienced. Tell me what questions you still have. I read every comment, and your responses help me understand exactly what you need most. Your breath is powerful. Now you know how to use it. Use it every day, use it consistently, and use it to take back control of your heart health. Starting today. I will see you in the next video. Until then, breathe deep and take care of your heart.